General introduction of sympathetic nervous system and detailed pharmacology of sympatholytic drugs. The nervous system is divided into two parts, the central nervous system and the peripheral nervous system. The central nervous system is consists of spinal cord, brainstem and brain, whereas peripheral nervous system is consist of the autonomic nervous system and the somatic nervous system. Then the autonomic nervous system is further classified into two, sympathetic nervous system and the parasympathetic nervous system. Introduction of adrenergic transmission. There are three closely related endogenous catecholamines. Catecholamines are a group of similar substances released into the blood in response to physical or emotional stress. The primary catecholamines are dopamine, adrenaline and noradrenaline. Dopamine. Dopamine is a type of neurotransmitter. Your nervous system uses it to send messages between nerve cells. Adrenaline. The overall effect of adrenaline is to prepare the body for the fight or flight response in times of stress. The third is noradrenaline, a hormone that is released by the adrenal medulla and by the sympathetic nerves and function as a neurotransmitter. Then the adrenergic transmission. It is divided into 6 steps. The first is synthesis of catecholamine, the second is storage of catecholamine, the third is release of catecholamine, fourth is uptake of catecholamine, fifth is metabolism of catecholamine, and sixth is adrenergic receptor. The synthesis of catecholamine. Catecholamines are synthesized from the amino acid phenylalanine. As you can see, it is given in figure. Tyrosine hydroxylase is a specific and the rate limiting enzyme. Its inhibition by alpha-methyl P-tyrosine results in depletion of catecholamine. Synthesis of non-adrenaline occurs in all adrenergic neurons, while that of adrenaline occurs only in the adrenal medullary cells. Then you can see in figure, the first step is the synthesis of norepinephrine. Hydroxylation of tyrosine is the rate limiting step. The second step, uptake into the storage vesicle. Dopamine enters a vesicle and it is converted to norepinephrine. Norepinephrine is protected from degradation in the vesicle. The third step is release of neurotransmitter. Influx of calcium causes fusion of the vesicles with the cell's membrane in a process known as exocytosis. The fourth step is binding to the receptor. Postsynaptic receptor is activated by the binding of neurotransmitter. Step is removal of norepinephrine. Release of norepinephrine is rapidly taken into the neurons. The sixth is metabolism. Norepinephrine is methylated by COMT and oxidized by MAO of catecholamine. Non-adrenaline is stored in synaptic vesicles or granules within the adrenergic nerve terminals. Next, dopamine is hydroxylated to form norepinephrine by the enzyme dopamine beta hydroxylase. Then the release of catecholamine. An action potential arriving at the nerve junction triggers an influx of calcium ion from the extracellular fluid into the cytoplasm of the neuron. The increase in calcium causes synaptic vesicle to fuse with the cell membrane and to undergo exocytosis and expel their content into the synapse. Then uptake of catecholamine. There is a very efficient mechanism by which non-adrenaline released from the nerve terminal is recaptured. This occurs in two steps, axonal uptake and vesicular uptake. The axonal uptake, an active amine pump, is present at the neuronal membrane which transports non-adrenaline by sodium coupled mechanism. It takes up non-adrenaline at a higher rate than adrenaline and had been labeled uptake 1. Then vesicular uptake. The membrane of intracellular vesicle has another amine pump, the vesicular monoamine transporter, which transport catecholamine from the cytoplasm to the interior of the storage vesicle. Then metabolism of catecholamine. The pathway of metabolism of catecholamine are depicted in figure. Part of the non-adrenaline leaking out from the vesicle into cytoplasm as well as that taken up by axonal transport is first attacked by MAO, while that which diffuses into circulation is first attacked upon by the catechol or methyltransferase in liver and other tissue. The major metabolites excreted in urine are VMA and 3-methoxy 4-hydroxyphenyl glycol, along with some metanephrine, normetanephrine, and 3,4-dihydroxymandelic acid. Autonomic nervous system. It is derived from Greek word autos means self and nomos means control, an involuntary nervous system that modulates and controls the function of visceral organs. Autonomic nervous system is largely involuntary and it is responsible for maintaining the internal homeostasis. It is divided into two main parts: sympathetic nervous system, parasympathetic nervous system. Sympathetic nervous system allow body to function under stress, fight or flight, primes body for intense skeletal muscles activity. Then parasympathetic nervous system maintains function, rests and digests, counterbalance sympathetic functions. Sympathetic nervous system. Its origin is dorsal-lumbar, distribution is wider in nature, neurotransmitter major is adrenaline and minor is acetylcholine. Heart increases heart rate, bronchi increases force of contraction, eye pupil dilation, urinary bladder, urinary retention, blood vessels constriction. These are the major functions of sympathetic nervous system. Then sympathetic nervous system. Sympathetic nervous system activations occur in response to stressful stimuli including physical activity, psychological stress, blood loss, etc., and prepares the body for the emergencies. Sympathetic nervous system stimulation led to increased heart rate and blood pressure, dilation of pupil, dilation of trachea and bronchi, stimulation of the conversion of liver glycogen into glucose, shunting of blood away from the skin and viscera to the skeletal muscles, brain and heart, inhibition of the peristalsis in the GI tract, inhibition of contraction of the bladder, and rectum stimulation of uterus and constriction of spleen capsule. Sympatholytic drugs. Their synonyms are anti-adrenergic, adrenergic blocking agent, adrenergic blocker, adrenergic antagonist. A sympatholytic is any drug that inhibits nerve impulse of the sympathetic nervous system. These are drugs which antagonize the receptor action of adrenaline and related drugs. Sympatholytic drugs reduce blood pressure by inhibiting or blocking the sympathetic nervous system. Depression of the sympathetic nervous system can be achieved with sympatholytics. Classification of sympatholytic drugs. They are alpha adrenoreceptor antagonist, beta adrenoreceptor antagonist, adrenergic neuron blocker, mixed alpha and selective beta 1 adrenoreceptor antagonist. As you see the relative selectivity of antagonists for adrenoreceptor.